Hello, my name is Dr. Catherine Hickman. I'm a GP in Bradford, respiratory lead for West Yorkshire and Harrogate, and also a certified tiny habit coach who is very passionate about using behaviour change to make changes in your life. And in this case, we're going to be talking about how you can remember to take your steroid inhaler if you have asthma. Now, I get it, right? Life is busy and lots of things get in the way of you remembering to take your steroid inhaler. But hopefully, your GP or nurse has told you that your steroid inhaler is the most important inhaler with regards to your asthma treatment. It is the inhaler that stops your airways getting inflamed. It stops you having asthma symptoms. It stops you having to rely on your blue inhaler, which, if you have well controlled asthma, you shouldn't be needing to use it at all. It also stops you ending up at the GP surgery or, worst case scenario, having an asthma attack and ending up in A&E. I get it. It's not easy to remember. But what I want to talk to you today is about a different way of remembering to take your inhaler. So it's not about post-it notes or writing on the bathroom mirror or setting your alarm to remember. It's about learning a new technique to remember to take your steroid inhaler every single day, whether that be once in the morning or more likely twice a day. And it really is as simple as ABC. And the behavior change model that we're going to use is something called Tiny Habits. And Tiny Habits was developed by this guy, BJ Fogg, who works at Stanford University and developed the Tiny Habits model in order to help people to embed new habits using the Tiny Habits method. And the A stands for anchor. And an anchor is something that we are already doing in our lives. It is automatic. And these can be such things as cleaning your teeth, turning on the bedside light, putting on your pants or your socks, turning on the kettle, looking in the bathroom mirror, or putting on your makeup. These are habits that we are already doing in our life. They are solid, they are automatic, and we don't even have to think about them. And what we use these for are, instead of using post-it notes or alarms or reminders, we use the anchor as the prompt to tell us to do our new behavior. And our new behavior in this case is going to be taking our steroid inhaler. So we attach our new behavior to our anchor, our post-it note or our reminder, such as turning on the kettle, looking in the mirror, cleaning our teeth, or putting on our socks. And we do our new behavior. And it might be as simple as just picking up your steroid inhaler or shaking the steroid inhaler or taking the cap off or looking at it or touching it. It might be that you don't commit to actually fully taking your steroid inhaler. This behavior needs to be tiny. It needs to be something that takes less than 30 seconds to do. And when you've done your new behavior, you then celebrate. This is where the magic happens. You celebrate. You smile, you feel good about yourself, you high-five the mirror, you fist pump. You do whatever it takes to tell your brain that this is something that you want to do. This is something that is going to grow into a bigger behavior, something that you are going to ultimately end up doing every single day of your life to treat that asthma and stop you relying on your blue inhaler. And once you have those three components, your anchor, your behavior, and your celebration, you put it all together as a recipe. After I look in the mirror, I will pick up my steroid inhaler and then celebrate by smiling. If you want to find out any more about Tiny Habits, please follow this link below, which I've also put in the comments. And thank you very much for listening.